Laser en bloc resection of bladder tumors, a European multi-center study to evaluate safety, efficacy and outcome. Bladder cancer is the second most common urological malignancy. Today, transurethral resection of non-muscle invasive bladder cancer using a wire loop is the standard therapy. Assessing the correct penetration depth of the tumor and removal of all visible lesions in one operation is crucial and may determine patient's prognosis. Potential disadvantages of the standard technique are thermal damage of tissue samples, the incise and scatter technique causing fragmentation of the tumor, the difficulty of accurate pathological evaluation, and high rates of missing detrusor muscle. The objective of the study is to evaluate safety, efficacy and recurrence rates of patients treated by laser en bloc resection of non-muscle invasive bladder tumors. Technical aspects. Laser en bloc resection was carried out either with thulium YAG or holmium YAG lasers in the described energy settings. Most commonly, a continuous flow resectoscope and a 550 nanometer bare fiber were used. Surgical technique. Circumferential incision of the tumor. First, a circumferential incision around the tumor using the laser energy is being carried out. Blunt dissection of the bladder mucosa. The bladder mucosa is bluntly dissected from the deeper layers by lifting the mucosal patch towards the bladder lumen using either the tip of the laser working element or the tip of the resectoscope's outer sheath, leaving the bladder facing part of the specimen intact. Separation of the remaining adhesions with the laser. Remaining adhesions are cut with the laser. Coagulation of bleeding vessels. Hemostasis is achieved by laser coagulation. Bleeding vessels are punctually coagulated. Extraction of the tumor. The tumor is extracted endoscopically in one piece with a grasper. Small tumors are extracted through the resectoscope's outer sheath. Larger papillary tumors up to 3 centimeters are extracted under endoscopic vision through the urethra. Cold cut biopsies from the tumor ground. At the end of the procedure, 2 cold cut biopsy specimens are taken from the tumor ground. Inclusion criteria. Patients with small solitary or multiple papillary lesions were included in our study. Clinical results. 3 academic hospitals provided prospectively collected data of 65 patients that were treated by laser en bloc resection between June 2010 and April 2014. 17 female and 48 male patients with a mean age of 63.9 years were included. The average tumor number was 1.65 and the mean tumor size were 2.4 centimeters. 61 patients were diagnosed with primary bladder cancer. One operation had to be switched to conventional TURBT due to tumor localization. The tumor was located at the bladder neck. The average operation time was 29 minutes. Bladder irrigation was necessary for less than 1 day in most cases. The average duration of catheterization was 2 days, and the length of hospitalization was 3 days on average. Complications were assessed according to the Clavin-Dindo classification. 3 patients required surgical revision. Hemoglobin loss was clinically insignificant with 0.15 grams per deciliter. Pathohistological evaluation. Pathological evaluation revealed 39 patients with PTA, 26 patients with PT1, and no patients with PT2 disease. All tumors could be resected in one piece. All specimens included detrusor muscle and the edges were tumor-free. All biopsies from the tumor ground were negative. In contrast to the usual piecemeal specimens, papillary architecture can be easily evaluated with our technique, thus allowing precise grading according to the current WHO criteria. Sufficient sampling of detrusor muscle ensures complete resection and allows for correct staging. Completeness of resection can be easily demonstrated by clear inked resection margins. Follow-up. Cumulative recurrence rates of patients with primary bladder cancer were 18.5% after a follow-up of 1 year. The rate of recurrences in the former resection area was low. Conclusion. Transurethral resection is the gold standard for the treatment and staging of non-muscle invasive bladder cancer. The current results show that laser en bloc resection is safe and effective for both treatment and staging of non-muscle invasive bladder cancer. Laser devices might be of favor when treating patients under anticoagulants due to their excellent hemostatic effect.